Maybe I can start by saying that Malawi is in the southeastern part of Africa, and it has a population of 18 million people. I just want to go straight to the cholera situation in Malawi. The two graphs are showing, the first graph is showing the cholera situation in Malawi from 2007 to 2018. Then the second graph, far right, is showing the WASH indicators in Malawi. So the message I want to share with you that with time, we have seen in Malawi that cholera burden has significantly reduced from 2007 to 2017. And then I can only mention that in 2017, we had 141 cholera cases and 1 death. 2018, we had 939 cholera cases and 32 deaths. This year, we had 25 cholera cases and 1 death. So the numbers are really going down. And on the WASH indicators, water supply coverage is at 87%. Households with latrines, toilets, 86%. Access to toilets and latrines, 93%. Toilets or latrines with hand washing facilities at 36%. And then proportion of villages which have attained ODF status, we are at 46%. So in terms of activities we are doing in order to control cholera in Malawi, basically these are the WASH activities, provision of potable water, including pot chlorination. I mentioned open defecation-free campaigns, and also we do hand washing with soap campaigns. We are also implementing IDSR, this is integrated disease surveillance response, in line with the WHO recommendation, with lab confirmation of cholera. We use culture most of the time to confirm cholera. And then we are also doing prompt and appropriate case management of cholera cases in the cholera treatment centers. We are doing OVC expansion, OVC campaigns, and cross-border surveillance. We are also working together with our neighbors, Mozambique, Zambia, and Tanzania. Then the other activities we are doing are activities on health promotion, health education. So this slide basically is showing you the OCV campaigns we've done, starting from 2017 to 2019. In fact, we started OCV way back in 2015, 2016. So the most recent one we've done in January 2019 was in Mangoji district, where we vaccinated 206,000 people. So because of time, I will not go through all the numbers we've vaccinated over time. So on the coordination mechanism, just to mention that in Malawi, we have got coordination structures for prevention and control of cholera and the rest of public health emergencies. These structures are both at national and district levels. They are called, for example, those that are related to us are called health clusters and WASH clusters. These clusters are coordinated by what we call Department of Disaster Management Affairs, DODMA. The Minister of Health leads the health cluster, where all related governmental and all non-governmental organizations, local and national, local and international members, we do meet regularly to discuss cholera issues. The cluster's main roles include production of contingency plans, which are used for resource mobilization to prepare and respond to disasters and public health emergencies. Sometimes we also do have joint health and WASH clusters meetings, where we do review progress in the prevention and control efforts, as well as planning and replanning of control activities. We also have technical committees that do report to these clusters. For example, we have a rapid response team committee or group. So the major challenges I can mention, I think it was mentioned, was it Sudan, I'm trying to remember, is that when you are working together with partners, and in a country like Malawi where cholera is going down, sometimes we see periods without cholera because cholera in Malawi is seasonal. It's only during the rain season. And during the dry season, most of the time, we don't have cholera. So when you don't have cholera, and you invite people to discuss to prepare cholera, they don't see the reason why they should come. They only come when you have got cholera or disaster in place. So that is the first challenge. The other challenge is that in order to avoid duplication and leaving gaps in terms of implementation of activities, we requested our partners to share with us who they are, where they're working, and how much resources they have for them in order to implement any cholera control activities. The challenge we have is that when you're asking partners in terms of resources they have, normally that information they will not tell you. Maybe it's because of the way we work when we're controlling cholera in disasters. Organizations, partners will start putting in resources when cholera is in place. But when there's no cholera, normally partners, organizations don't put resources for that. I think the other challenge I just want to mention is the basic financial challenge. We know that finances will never be enough, but we need more money for implementation of cholera activities. I just also want to mention the challenge we had. Malawi was one of the countries that was affected by Cyclone Idai in March 2019. And this caused communities to be displaced, and also it means that the wash infrastructures were destroyed. This was mainly in the southern part of Malawi. So this slide is talking about the expected support from